Alrighty. Well, good afternoon. Welcome to the Ask the Expert series with the Epilepsy Foundation. So today's speaker joining us is Alisa Newsabam. Did I say that correctly?
Perfect.
Awesome. So she is a clinical dietitian nutritionist with the Pediatric Neurology Department at Yale New Haven Hospital. Oh my God. So after earning her undergraduate degree at Boston University and working for many years in television broadcasting, Alisa returned to school at the age of 40 to pursue her passion for nutrition education. So now many years later, she earned her registered dietitian degree from Yale New Haven Hospital and her master's in public health from UMass Emirates. So Alisa runs the ketogenic diet clinic for neurological disorders at Yale, and that covers pediatric GI clinics. She also helps manage the Human Nutrition Research Unit. Alisa also teaches nutrition to first and third medical school students at Yale School of Medicine and routinely speaks at conferences and meetings worldwide. So I will now pass it over to her to begin her presentation, and we can also hold off on questions until after the presentation, and I will be gladly monitoring them.
All right. Hi, everyone. Thanks so much, Amy. It's Elisa. My name is Elisa Nussbaum. I'm here at Yale, and I work in the epilepsy clinic. And today we're going to talk about ketogenic diet therapies because I am a registered dietitian. And since graduating with my RD degree, that's what I've specialized in. Amy, should I share my screen? Is that
Yes.
okay?
Yes.
The participant screen sharing is disabled.
Sorry about that. Hold on one second.
Okie doke. I got it. It's up now.
Awesome.
All right. So I'm just going to assume everyone can see this. I'm Lisa. I'm a dietitian covering ketogenic diet clinic since 2012. And I also, as Amy told you, have a pediatric GI clinic, and I help manage the Human Nutrition Research Unit. I'm going to start off with a few success stories because these make me so happy. The first one I'm going to tell you about is HF. HF was a 2-year-old girl that came to us, and we started her on a 3-to-1 ratio. And the thing that I remember the most about this little girl is in her first office visit with me, Mom said she has seizures like clockwork. Once an hour, she will have a drop seizure. Mom looked at her watch and said she should have one in the next 2 or 3 minutes. And Mom was right. 2 or 3 minutes, we saw a drop seizure from this little toddler. Now, these parents were so great. They started to take the obvious sugars away from this child before we even initiated the ketogenic diet. Parents took away juice, chips, goldfish snacks, and she had quite an improvement in seizures before we even initiated her into the diet. We saw a 90% improvement in her seizures at discharge. She was seizure-free by the time she had been on the diet for only 4 weeks. After 2 years, we weaned her off of the diet, and we'll talk about that later. Some kids can be weaned off the diet, and she's been doing beautifully. Side effects we saw, the biggest side effect we saw with this kiddo was really severe constipation. We're going to talk about that later too. The next happy success story I want to tell you about is little EF. So this was a baby, an 8-month-old with infantile spasms and a few other neurological issues. We put this kid right on a 4-to-1 keto ratio through formula by mouth. There was almost an 80% improvement in seizures by the time we discharged this baby. The kid was completely seizure-free 2 months into diet initiation. And then just before around 19 months, we weaned this child off, and this child did well. Infantile spasms specifically, we keep the kid on for just about 2 years during the time that the infantile spasms would do some damage from the seizures, and then we wean them off. The side effects that this little guy had were mainly acidosis, which is when your CO2 drops, and emesis. Emesis is another word for vomiting. So we saw some pretty severe vomiting and acidosis with this kiddo. But we did get some seizure freedom, and we were able to manage those side effects. The last success story I'm going to tell you about is E, and we were actually just talking about this kiddo before we logged on. E had refractory epilepsy, cerebral palsy, and there was severe prematurity, and he was born with some addiction issues from his birth mother, who he was no longer with. We did formula by mouth for this kiddo, and within 6 weeks, we saw a 90% improvement, and his adoptive parents were sending us pictures of him singing happy birthday and playing games and interacting. It really, really remarkable family and remarkable kid. And this child remains on a modified version of the diet. So here's a little video I'm going to play for you guys to show you what we do here.
So when our son first started experiencing seizures, scary, stressful, devastating. Such as it's most basic form. Ketogenic diet is a half and then have a hydrate diet. But you can have many variations for specific. Tested and this last had a non-supportive ways of dealing with this, which I would means also start first because we see what happens. Want to try option first. Make sure that not only had to read us, some kind of event or some side effects and travel and rather than less some of these families not very good seekers, emergencies.
So that's what we do here. I love that because it's a really nice sort of general introduction to the diet. Every kid we treat is very different, but that sort of shows you the spectrum of kids that can be helped by this diet. So, additional uses for the ketogenic diet, in addition to just for epilepsy. There's research going on in a bunch of different areas. Status epilepticus, diabetes mellitus, traumatic brain injuries, and all kinds of other neurological disorders, including migraines. So there are more applications for the ketogenic diet in the neurology world, and we're really excited to find out more of those as our research continues. So I'm not sure how familiar most of you are with the ketogenic diet, but when I'm out in the general public and I mention the ketogenic diet, this is what people consider a ketogenic diet. And this is really not. This is a low carbohydrate diet. This is even, I would say, a protein high diet. So this is what people think. What it actually looks like is more like this. And if there are any keto parents, they'll be very familiar with these pictures. So this one is our keto mac and cheese that's made with a special kind of noodle called a shirataki noodle. It's all fiber. These are our substitute keto pizzas, a little bit of berries, and you'll be very familiar with this food scale because everything we do on the classic ketogenic diet is weighed and measured on this food scale. So the history of the diet is really pretty interesting. There are actually mentions of the diet hundreds of years ago where when people were having fits, they would starve them and the fits would stop. But of course, that's not really an appreciable way to control your seizures because you're not getting any nutrition. Much later in the Mayo Clinic in the 1920s, they recognized that it was actually starving the body of carbohydrates specifically that put people into a state of ketosis that helped with seizures. Now, there are hundreds, well over 200 keto centers worldwide. And at our Yale Keto Diet Clinic, we do a lot of work with grants. We do a lot of research, poster presentations, articles that we're invited to collaborate with, projects in collaboration with other keto centers and the Connecticut Epilepsy Foundation, and webinar presentations much like this one. So basically what happens, and if you have a kid with seizures or an adult with seizures, you'll know this. Most people are lucky enough to see some seizure freedom with the first drug that's tried right here, this 47%. Then another 13% get seizure freedom with the second drug, and a smaller group see seizure freedom with multi-drugs. But that leaves this 36% that do not achieve seizure freedom, even with anti-seizure medications. And I'll say this right up front. If you have seizure control using medications, that is the way to go. It is far, far easier than implementing this very complicated medical nutrition therapy. It is much easier to take the medications, and the medications do have side effects, but so does this diet. And we'll talk about those in a little bit. So the diet basics, if you're not familiar with it, it is a high fat, low protein and carb combined. So you'll see when you talk about a ketogenic diet, a lot of ratios used, 4-to-1, 3-to-1, 2-to-1. So that number 4, that first number here, that's units of fat. The second number in the ratio is units of protein and carbohydrate combined. So you can see if we want you to get adequate protein, that leaves very, very little room for carbohydrates. So it's units of fat, 4 units of fat for every 1 unit of protein and carb combined. This is a higher ratio. We do lower ratios as well. Low is 1-to-1, high is 4.25-to-1. The higher the ratio, the lower the amount of protein and carbohydrates. Now, we used to initiate the diet in the hospital if it was a 3-to-1 or higher. Since COVID, we've been doing a lot more home initiations. They're challenging. They go a lot more slowly instead of doing it over 3 days, where we have a whole team of experts to oversee it and help us. We do it very, very slowly at home. But I really hold the hand of any caregiver that's doing this. So when you do it through our center, you have a lot of support. The diet is precisely weighed and calculated on a gram scale. and I work with parents to teach them how to use the gram scale. As with medications, the diet is very specific to a patient's needs. Even the carbs in medications or toothpaste or lotions, anything that can be absorbed through a mucous membrane, chapstick, those we calculate the carbohydrate content of for the classic keto, the 3-to-1 or 4-to-1. This is what I'm talking about when I say the different ratios. So the classic ketogenic diet is considered a 4-to-1 or 3-to-1 ratio. Then we have MCT oil, where we add MCT oil to the food, and that's usually a 4-to-1 or a 1-to-1 ratio. Modified Atkins diet is really a carb counting way to go about the diet. And low glycemic index therapy is balancing foods, taking higher carbohydrate foods, mixing them with higher fat foods to get to the ratio that we want. Now, what we do here at Yale is if the patient's on classic ketogenic diet, that's one thing. We teach them that everything is weighed on a food scale, on a gram scale. There's micronutrient supplement actually with all of them. And there's calorie restrictions on the higher ratios of the diet. What I like to teach families is a combination of MCT oil, counting carbs or modified Atkins, and low glycemic index therapy. That way, whatever situation a family member or a parent is in or a caregiver is in, they can figure out how to do what's best for their kids. The kids on the classic diet don't have that kind of leeway, but with the lower ratios, I can teach parents how to be at a restaurant or be at a family party and balance the intake of carbohydrates with extra fat or count the carbohydrates so you know how appropriate. So who gets put on the diet? Traditionally, we have patients who have failed on 2 or more anticonvulsant therapies, medications. Um, we used to only do pediatrics, but more and more we are doing adults. We are helping adults with the ketogenic diet. There's a little bit of improved efficacy the younger you are, but I have lots of adults that do beautifully on the diet. And those adults we do not put on the classic diet. I more do the modified ketogenic diet so that you can go on with a relatively normal life and normal eating habits and just balance them yourself. All different seizure types. Minimum time on the diet, we do ask people to give us a commitment of 3 months to see if the diet can work, mostly because there's a lot of bumps along the way and a lot of things we need to iron out. So we do ask for 3 months. So the papers, the research says the average time on the diet is 2 years. It's really patient dependent. Like I said, those kids with infantile spasms or types of neurological diseases that are confined to childhood, we might only have them on the diet for 2 years. People that are older or have more of a genetic disorder, you might need to be on the version of the diet for a very long time. If it's something like a GLUT1 disorder, it could be your whole life. I more quickly consider this diet for G-tube or formula-fed patients because it's so much easier to just switch a formula than it is to redo all of the food that you're used to eating. So formula-fed patients, particularly G-tube kids, love them. But that doesn't mean we can't do it with kids that eat by mouth. We have lots of kids that are really successful on it. We do make sure that any patient considering this is screened by the doctor, the dietitian, that's me, our nursing team, and social work to make sure that we are setting a patient up for success. This is just sort of a nice list of the highly responsive conditions and the moderately responsive conditions. So this was identified by a panel as conditions from at least 3 publications that we've looked at. So these are the ones that seem to have the best response to a ketogenic diet. And these ones down here have a more moderate response. But I do encourage parents with kids with those issues to try it if the medications aren't working, because often, even if we don't get a home run, we see an improvement. And interestingly, sometimes in addition to just seeing the improvement in seizures, we see some other neurological improvements on the ketogenic diet. a lot of parents will tell me that they see improved focus, improved motor skills, improved vocalization, improved mood, and better sleep habits at night. So those are all really great things for kids that have different neurological conditions. So sometimes it's not always about the seizure. Sometimes it's a little bit of better seizure control plus all of these other benefits that we're seeing. Side effects. One of the things that I always do with parents is manage expectations, not only with seizure control and what to expect to see, but also with side effects. Number one side effect is constipation. I can almost guarantee that you're going to have pretty bad constipation, and a lot of the kids have constipations before they even start the diet because they might not be as mobile. They might be on medications that cause constipation. So that's something that we really stay on top of. Reflux, that's something we see pretty often. Acidosis, as your ketones go up, your CO2 can drop because of the acid-base balance. So we keep that in mind. Kidney stones, we always push water to try to avoid kidney stones. High cholesterol, we're going to see it on a ketogenic diet, right? It's a high-fat diet. So we're going to see the high triglycerides. We're going to see the high cholesterol. We're going to see the elevated lipids. Sometimes I worry about it, sometimes I don't. If you have a young kid, I don't know that I care so much about what their cholesterol is. We can worry about that when they're 40 and maybe not when they're 8, but it depends. Sometimes it's high enough that it does concern me. And a lot of times I'll address that by switching to a more plant-based diet. Makes the diet more complicated, so I often don't start with a plant-based diet, but we'll work in some more plant-based foods that are known to lower cholesterol and help with lipids. Delayed growth, that's something we expect to see because we are limiting calories in addition to limiting carbohydrates. But I will tell you, when the kids go off the diet, most of that growth catches up. And also, I always explain to parents that we're really trading off body health for brain health. And just for the moment in time, while the child's on the diet, we're focusing on brain health and brain growth. And we'll worry about the physical growth later. Pancreatitis, obviously, because of the high-fat diet. But I'll tell you, I think in my 12, 13 years doing this, I've only seen that once. So I don't really get concerned about pancreatitis, and we monitor labs, so we'll know if it's happening. So when we teach a parent about the ketogenic diet, I spend a lot of time with parents. I train them on using gram scales, recipe prep, fluid schedule is really important. Obviously, we talk about expectations for success and roadblocks. Roadblocks are everywhere with a kid on a ketogenic diet. And if you have a kid that's maybe an adolescent and has a little more independence, it's even more challenging. Families, well-meaning family members can be a bit of a roadblock too. So I sort of sit down with the family and find out how they live and what their lifestyle is so that we can anticipate some of those roadblocks before they happen. I'm always happy to talk to school districts, talk to other caregivers. If a family is traveling on the ketogenic diet, I'll write letters for TSA because they're going to be traveling with gram scales and lancets and other formulas, things that they might stop you with in the airport. We also teach you about testing ketones. A lot of times I'll have parents come into the hospital, even if we're doing a home initiation, and that way they can join me in the research kitchen and we can have a real hands-on cooking lesson and lesson in formula prep. If the diet is initiated in the hospital, those are the sorts of things that we look at before we discharge. And if you spent any time in the hospital, you know that we typically use 70 as a blood glucose level, but because we're restricting carbohydrates, we use 50 for anyone on the ketogenic diet. We look for moderate to large urine ketones. So we test urine ketones and we test blood ketones. You can test urine ketones at home. It's super easy with little test strips. Everyone on the diet that isn't formula fed, because formulas are nutritionally complete, gets a multivitamin. So if they're eating by mouth, they get a multivitamin. There is no way to have a nutritionally complete diet on a 3 or 4 to 1 ratio of the ketogenic diet. You have to take a multivitamin. A lot of times we also do calcium and vitamin D because the ketogenic diet, along with many of those anti-seizure medications, can leach the calcium from your bones. So we want to make sure, and lower vitamin D, so we want to make sure that's adequate. Oral citrate, that helps with the acidosis that we were talking about before. And then as needed, we do laxatives, carnitine, selenium, and some other micronutrients. The carnitine is an important one. So carnitine is a substance that we all have naturally in our bodies, and it's what helps us take fat and break it down into energy. So we have natural stores of carnitine, and then we also get dietary carnitine, mostly from meat and dairy. But as you can imagine, when you're on a very high fat diet, it's unlikely that you're going to have enough natural or dietary stores of carnitine in your body to break down all of that fat. So my patients often need a carnitine supplement. One of the things that we've started doing in the past couple of years with our tube-fed patients is a blenderized tube feed. So there are fantastic commercial keto formulas out there. They're really great. But what we found is that working in 1 or 2 blenderized tube feeds of whole foods that you put through the G tube can help. It can help with constipation. It can help with those elevated lipids. It can enhance the gut microbiome. Instead of just having that same formula every day, we're working in whole foods. We can work in foods that are important to the families. So if there's if there are important cultural foods that families want to incorporate to make the child feel like they're part of the family, or an important cultural celebration, or even a birthday, that's something that has been really, really fun. And I've really enjoyed working with families to come up with blenderized tube feeds that they can use occasionally or frequently, depending on what makes it easy for them. Some considerations for blenderized tube feed, because it's not appropriate for everyone. You need good enteral access. So the French size, the size of the tube, larger is preferred, because as you might imagine, those home blends of formulas are going to be more viscous. They're going to be thicker than the commercial formulas. So we have to make sure that we either break it down enough in a really good blender and add enough liquid, or it's small enough to fit through the tube. We tend to not use the pump. I find that it's much easier to do a bolus or a gravity bag with these blenderized tube feeds. And we do a lot of education and support for the family when they decide to do a blenderized tube feed. Look, it's not appropriate for everyone. And you're certainly not a bad caregiver if you choose not to. It's just another tool to have at your disposal if it's something that you want to try. And one of the reasons that I encourage the blenderized tube feed is I have seen it do incredible things to help with constipation. There's something about a whole genuine food instead of a formula that really helps the gut microbiome and enhances that motility. So this is a little more personal. This is just the patient support that we give in our ketogenic diet clinic here at Yale. And this is the best part of my job. These are really, really fun things that we do. We, of course, have our clinic with our amazing team of doctors, specifically Dr. Knight, who is really the #1 ketogenic diet doctor in Connecticut. You have access to me via phone, email, visits. We have videos. I have a bunch of YouTube videos, short, less than 60-second videos that I send out to parents to help them. We have this booklet that we're hoping to redo this year. And if anyone wants a copy of this booklet, I'm going to have my email at the end of this presentation. Just shoot me an email, I'll throw one in the mail to you. We do holiday parties. You can see a picture from one of our Halloween parties here, and these parents did this adorable bacon and eggs costume, and they had their kid they made a heavy whipping cream costume for their kid, which is amazing. I'm frequently on podcasts. We do virtual cooking classes online. And like I said, with cultural considerations, just because you have a kid on ketogenic diet doesn't mean they can't be a part of family meals. I really encourage families, when possible, to adjust their ketogenic meals so that there is a similarity to what they're having at home, because we want these kids to feel and be part of that family, part of that coming around and joining. I have tons of keto holiday recipes, and they're perfect for everyone. So you can put them on the table along with the other recipes, along with your other holiday foods, and just encourage your kid to only have the keto recipes, but share them with everyone else. So this is something that I put together. These are real tips from moms that I called and bugged for the purposes of this presentation in the last couple of weeks. Whenever I was on the phone with a family member, I said, hey, I'm doing this presentation. What would you say to other parents considering this diet? And there are some real gems here. Cooking in batches and freezing for the week is huge, especially if you color code your meal containers, because then you can have your lunches, your dinners, your breakfasts. You know exactly how many calories and the ratio of each container. You stack them in your freezer, and in the morning you pull them out, or the night before you pull them out and defrost them, and you're good for the next day. Another great comment here is the backup. Bringing some keto formula. We have these keto supplemental beverages, and they even come in chocolate. So having that with you, or even I always encourage parents to have a case of those in their basement in case your power goes out, or there's a snowstorm, or there's some kind of natural or family disaster. You have a family full of sick kids and you can't get to the store. And this way you have a case of formula in your basement and you're fine. Some other really good, I love this one, but blenderized tube feed for the win with constipation. I can't overemphasize how much that has helped families. And a fat bomb at night. Some of those most stubborn seizures that I see with kids are the ones that are in that in-between waking and sleeping state. So I find that a fat bomb about half an hour before bedtime can do wonders for those seizures. My references, because I'm a research dietitian, so I have to have lots of references. And I'm happy to take any questions now. And this is my email address. So if you want to write it down and reach out to me with any questions, if you want a copy of this booklet here, or you want a link to our recipes, the YouTube page, I'm really happy to provide those. So I'm going to go ahead and unshare my screen. And we should be good if you have any questions. Are we good, Amy? Did anyone have anything?
As of right now, no, I don't see any questions. So you can feel free to put it in the questions and answered box. I have one. I need to type for a minute. Okay, so we have one. She's going to type.
All right, no worries. Dr. Knight, did you have anything you want to add? We're waiting for a question.
Well, sorry, I've been popping in and out to deal with some little emergency issues, but thank you guys for joining. It is really a great program. I know it's sort of a weird format here on webinar. Don't hesitate to reach out to our team if we can kind of provide some tailored information for your child or your family member.
Thanks, Dr. Knight.
I should have done my hair.
Great. So I think Amy wants you to unmute her so she can ask the question. Or sorry, Paige.
Let me see.
Yeah, there she goes. Hi, Paige.
Oh, hi. Okay, I was trying to type as much as I could, and I was like, this is too much to type. Thank you so much for the presentation. This is awesome information. So I am an adult. I'm 30, just turning 30 this month. I am on a lot of medications, and I'm also currently transferring onto a new medication, and trying to start a family. So I'd like to try to conceive at some point, but um, right now it's just very difficult. I'm definitely over medicated in this transition process. And I also am not sure if this new medication is going to work. But regardless, I am looking for alternative options. I'm a holistic health coach. I really want to try to find the most holistic approach. And I know that you had mentioned, do the medications if you can, but I'm at a point in my life where it's just, I'm hearing what other people are taking in my support group and things like that. And I am just on another level of how much medication is going to my body every day. And it does impact my, tired. I mean, like all of the symptoms, and I'm already constipated, so I'm open to this one. Just, but I'm just curious if you think that, so what level? I mean, I don't think I could ever do the 4-to-1 ratio or anything like that, but to what level would you recommend for an adult? And I have noticed definitely that when I decrease carbohydrate intake, my activity does go down. Gluten causes a lot of chaos up there. I've recognized some of those things. So what would your recommendations be, considering all of that? I know that's a lot. So yeah.
Yeah, so without having access to your chart or knowing all of the details of your progress and your neurological issues, I can't really give you specific to you recommendations, but I can give you some general recommendations of what I would say to someone who might be similar to you. The first thing I would say is that 30 is not too old for the diet. I think neurologically, I don't really consider anyone an adult neurologically until they're like 27, 26. I think there's still some elasticity that changes around that changes the efficacy of the diet, but I still see it work with people even older than that. What I would do if I were seeing someone like you, I would consider a modified ketogenic diet approach. I would aim for maybe a 1-to-1 ratio. And I would focus on really plant-based foods that are high in fat.
Okay.
Healthy oils, avocados, seeds, nuts, those kinds of plant-based foods. Not only are there's going to be higher in fiber, so they're going to help with that constipation, but someone who is 30 is going to start to want to think about lipids and high cholesterol and things like that. Now, because you have some training with health coach and eating for good health, you're someone that I might say to, this is something you can do. When I say that you should always do the medications if they work, that's because for most people, it's going to be much, much, much easier to take their medication than to change their entire lifestyle of eating, particularly if we're talking about a child. For children, it's way, way easier to get them to take meds than it is to get them to eat an avocado.
Sure.
So that's sort of why I always push the meds. But keep in mind, Paige, just as there are side effects with the medications, there are side effects with this diet. This is by no means a healthy diet. This is a diet that will tax your body. There are some benefits, and the lower the ratio, the less of those side effects you'll have. So at a 1-to-1 ratio, it's very doable for you. But if you reach out to me via email, then I'll send you some of the information I have, and you can show it to your provider. But I really would encourage you to talk to your neurologist to see if they think that this is a good idea for you.
Okay, thank you for the info. I think also it might just be just a good supplement to the medication I'm already on. So maybe it would be able to help. And I know that I'll never come off medication after all the surgeries and everything. So it's just kind of I know I'll never be off medication, but maybe there's something I can do within my diet to, even if it's modified, or I understand what you're saying about the lifestyle. So even if it's just being a little extra conscious of what to have and what not to have and how to make better choices for it, maybe it could be somewhat helpful, even if it's just a little bit at a time.
Yep. And you're absolutely right. I think the vast majority of our patients are on polytherapy. So they're doing the ketogenic diet alongside some medications. And then as they get older and larger physically, we might not increase their meds. And so we sort of wean them off that way instead of actually weaning them off the meds. But
Okay.
thanks for the question, Paige. That was a great
Yes.
one.
I will reach out. Okay, thank you so much.
You're welcome.
We do have one from Neil and Jane. They both say thank you for the keto presentation. They would like to know about fluid intake. From Jane, our son is 27 years old and is on 2 meds, but still has seizures. They don't happen very often. He's had 7 since 2019. Do you think the diet is worth a try for him? His team is based at Yale. Also, he has been told to restrict fluid intake to 48 fluid ounces. So what is your opinion on that?
So for someone who is only having 7 seizures since 2019, I don't know that the amount of work that you would have to do for this diet is worth it. That's up to you guys. What you might want to do is try it at a low ratio and keep really diligent notes to see if you are seeing any kind of improvement. But with that few seizures, that's going to be hard to do. The fluid restriction that you're mentioning, that makes me think that there are other medical reasons for a fluid restriction. So I can't really speak to that since I don't know what other medical concerns your son has. But it sounds to me like that's not because of a neurological issue. That's a different medical issue that he's having. None of my patients are on a fluid restriction.
Thank you. I have a question.
Mhm.
So are there any specific food recommendations or like meal planning tips that you recommend for someone starting or following a ketogenic diet?
Yeah, so I always start with some basics. Take the list of the foods that you like that are high in fat and have adequate protein, and let's see how we can work with those. So like eggs. Eggs are pretty commonplace, that a food that even younger kids will eat and enjoy. So I will often start with scrambled eggs mixed with heavy cream, cooked in butter with a side of avocado, and we'll measure it out to whatever ratio they need. Another really easy food is using the keto supplement shakes. A couple of different companies have them, and using those to make smoothies. That's super, super easy. You can take that high 4-to-1 ratio formula and mix in some fruit, and that's going to bring the ratio down. So we can use that high ratio formula, mix in some high carb foods, healthy ones, fruits, vegetables, to make it more palatable and get it to the right ratio. So those are my sort of 2 first go-to ones.
Awesome. We have a statement from Jane. The fluid restriction was to do with sodium levels.
Oh, gotcha. Okay, so that makes sense. So that's probably a result of some of his anti-epilepsy medications. Some of those anti-seizure meds can really cause some issues with sodium. So that's probably why that was.
Okay, do we have any other questions? Doesn't look like it. So this webinar will be on our website, epilepsyct.com. So you can feel free to always go back to it and use it as a reference, and you can share with whoever you please. Lisa, thank you so much for taking the time to do this for us. This is great. It's very helpful, very knowledgeable. We really appreciate your help.
Awesome. Thanks so much, Amy. Thanks, everyone. Bye.
Have a good night, everyone.